afternoon, everyone. Good afternoon. My name is Dr. Jamila Sharif. I'm a GP in Northwest London. It's my pleasure to be here today with you all to chair this session. A very warm welcome to you all. This session is to launch some new guidance on end-of-life and palliative care for Muslim patients. It's guidance both for service users and service providers. It addresses a very important need that we've found to improve the cultural and religious literacy of healthcare providers. And we know about the lack of access to palliative care services and end-of-life provision for Muslim patients. These findings we know from a Muslim Council of Britain and Cambridge University report published in 2019. So this guidance is a very important next step in addressing the needs that were found in the Muslim community. This guidance also aims to support Muslim families in accessing care. We know about inequalities in access, and this may be due to understandings within the community, stigmas within the community. So this guidance is very important in addressing this. It addresses both the training needs for healthcare providers and improves awareness within the community. End-of-life care and choices and understanding around this for Muslim patients are determined very much by values and beliefs around death and dying. And it's important to increase knowledge amongst healthcare providers around issues. For example, when Muslim patients are at their end, they want to be able to say the testimonial of faith, and then there may be issues around concerns about being sedated by palliative drugs or medications, and so therefore resistance to seeking help. There's a very important desire from families to bury the body quickly due to the beliefs around the journey of the soul. So all these things are some things that we're going to discuss today as we tell you a little bit about this report. The format of the session will be, we'll have the authors of the report, Dr. Hina Shahid and Imam Muhammad Asad, telling you a little bit about the report and what it covers. We'll address some of your questions. Please put all your questions and comments into the chat. We'll address them towards the end. You'll also be welcome to address your questions directly to us if you'd like to. There will be a feedback form at the end that we'll post in the chat that we'd like you to complete. So introducing the authors of this report, we have Imam Muhammad Asad. He is the Imam at the Birmingham Central Mosque, and he is a Muslim hospital chaplain. He served the community during the COVID pandemic. He has delivered training on end-of-life care for Muslim patients to healthcare professionals. Dr. Hina Shahid is a GP in London, and she is the chair of the Muslim Doctors Association. She is a trailblazer in her work to promote health in the Muslim community and address inequalities. So with that, I'll now welcome Imam Muhammad Asad to tell us a bit about the report.
Okay. Thank you so much. Good afternoon, everybody, and thank you ever so much for joining us on this very busy day of yours during the lunch hour. Really like to thank you so much for taking out your precious time. And I'd like to thank Dr. Jamila for the kind introduction. The full details you'll find about myself and Dr. Hina in the guidance itself. In short, I'm working as a chaplain with the various NHS trusts, also as an imam and a leader in the community. So the COVID period has taught us all a lot of lessons. So I just want to touch a bit about the background of this guidance. Where has it come from? What was the purpose and the need of it? And just briefly about the guidance itself. And you all will have been sent a link, and you will be able to read through it and digest it. And later on, if there's any questions, even in forthcoming weeks, months, or whatever, you can always reach us via the email and give us your feedback, suggestions, and where and how we can take it further. So a bit about the background of the guidance. Well, during COVID, working as a chaplain on the front line, there were many scenarios, many scenes that I saw. There were many questions being asked by patients, by families, by healthcare staff, that how should we do what? And normally when it's a time when you're being called in and it's an end-of-life case, you know, that is not the opportunity and a chance to give a long lecture about what you do and what you don't. You just briefly look at the situation and you move on, and you can give brief guidance. But just felt there was a need to have some kind of guidance which you can hand over, where the families can read through and get better information and guidance and assistance and support from it. So it's like a scenario where families have been told that, okay, over the weekend, we'll see how the patient gets on, and then Monday morning, we draw in treatment. So what do you tell the patient? What do you tell the family? There's a lot she can tell, but there wasn't any material that I could have handed over and said, go home and go through this. And, you know, this is some guidance and support that we're giving you. And, you know, if there's any questions, I can help you further, whatever. And there were times where staff had a patient end of life, and they knew that, you know, the treatment is going to be withdrawn, and he looks religious, but there isn't any family member or nobody with him, and they wanted to do something. They wanted to do the best for that family member, for that patient, and there wasn't anything that you could hand over to those healthcare workers and tell them that, you know, you'll find some guidance in this. So thought long and hard about it, that let's put something together. And end of life is a situation that you don't normally in life get a chance to do any rehearsal for. So it was that thought that you want to pass on information so that the family members, the loved ones, and the staff don't have any regrets later on, that only if I knew about this, I could have done it this way or that way. But when they look back, they feel no regrets at all, that they were able to do the best for their loved ones when they were in that critical situation. So death is a reality that we all will face one day or another. It is a taboo subject, which we, you know, people in the community don't like talking about it, but there is a dire need for it. And as we see that, you know, even this event today, without much publicity, we have, you know, close to 500 people registered for this event today. It just shows that, you know, how much need there is to do work in this area. So just to clarify that, you know, the guidance itself, it's not an academic research paper at all. It is not a replacement for local guidances or organizations that have their own policies. So whatever's already out there, it's brilliant, but we need a lot more work. So it is only to complement what is already out there. And especially in situations that I found myself that, you know, there wasn't anything and people were requiring help and guidance. So in that short amount of time, you could only say a few things, but, you know, if there's a guidance that we can give everybody, if I can just request everybody to put themselves on mute, so it'll save us any hiccups. So yes, so it is a complement. It is to complement what is already there in place. And I'd like to take this opportunity to thank Dr. Hina from Muslim Doctors Association, the chairperson, who took out her valuable time to co-author and to put this guidance together. Like yourselves, we both are extremely busy with many other jobs and roles in the communities and nationally. So this was a guidance that we wanted to take out 2 years ago, but because of many challenges and many difficulties, we have been able to launch it now. So it's better late than never. So thank you ever so much, Dr. Hina, for taking out your time. Briefly about the guidance itself. During COVID, we saw one verse of the Quran, which was repeated all over. We could see it plastered outside the mosques. And it was, "Man ahyaha faka'annama ahya an-nasa jami'a," that whoever saves one life, it is as if he has saved whole of mankind. So sanctity of life and preserving life, it is something which is given priority in Islam. And even though the guidance is titled End of Life, many Muslims will not look at it as end of life, but they will look at it as a beginning of a new life. So a Muslim believes that, as soon as death comes, you start a new life and the life in the hereafter. And there are many beliefs which overlap the Jewish traditions as well. So when it comes to preserving life, sanctity of life, when it comes to suicide and many other issues about burial, the fast track burial, we see that, these Abrahamic faiths, they have things in common. And as a chaplain, when we go to see a patient end of life, we give them comfort and we talk about the life hereafter. And even if it's the family members have been told that treatment is going to be withdrawn, so we take comfort in talking about where this individual is going next. And it is not that, that this person is going to go from the surface of the earth, we're never going to see them again. But as a Muslim, we believe that there's a life in the hereafter, and we are going to meet up with each other. We talk about the prophets that came into this world, they have gone. We take comfort from the role model for a Muslim, who is the Prophet Muhammad, peace be upon him, that he lost his parents, he lost his children in his own life. And how did he take this? And we seek comfort in knowing that we are still attached to those people that have left, by we are able to do good deeds and pass on the reward to those people that have passed away. And it is a place where we will go one day as well. So there is a lot of positivity, and we talk about all the positive things. In this guidance, you will not find the answers for every single thing. It is very difficult to produce any kind of guidance which has answers A to Z, but you will find a lot of answers for the questions you might have. And there is one Islam, but there are many Muslims. So we need to understand the patient, the person that we're looking after, that we need to meet their wishes, desires, and requirements. So even in Islam, the guidance that you'll find inside this booklet is general guidance, and it is not directions that you must do this. No, it is just to give you information about the Muslims. You'll find they do things like this, and they might do things like that as well. For example, organ donation, that is a subject itself. There'll be some who will believe it's fine and some who will understand that it's not fine, and they will have their own reasons for it. So when it comes to looking after a patient, the patient and their needs and requirements are a priority. And even as a Muslim, even as a Muslim chaplain, when we go to see a patient, that we ask them that what they wish. And if they ask for any guidance, it's about giving them informed choices, that whatever they wish to do, that we would try to fulfill their requirements and needs in the best possible manner. There would have been occasions where a patient or a family member might ask me to do things that I might not be practicing myself, but it is an alternative choice which exists in Islam. So I would try to meet their needs rather than imposing things upon them. So health workers, many of the time, that they would want to do their best, and they do their best for the patients, for the people that they are looking after. And sometimes just because of a slight misunderstanding, that it can cause great upset to the families and the loved ones. So the purpose of this guidance is just to raise awareness, complement things that are already in place, and especially in those places where there isn't any guidance and staff would like some information, they can go through this, and it will only help that if there's a staff member there and looking after a patient, they would know some of the do's and don'ts, which can avoid great upset for the families if they find out later, or this was removed, or why was this over here in this place. So small things can, it can make a huge difference both ways, and if you've done something positive, that can go really well with their family, that they were not able to be there for their loved ones, but the staff member done this or done that or whatever, and they'll really appreciate all the great work that you're doing. And just to clarify that, this isn't any project that has received any funding from anywhere or from any organization. It is just merely myself and Dr. Hina, so from Muslim Doctors Association, and myself, that we independently put this together and we financed it ourselves. If any organization or anybody wants to reproduce this, then there is permission to reproduce the whole booklet in the same format that it is. And if anybody's got any suggestions, feel free to contact us and to email, and we can look into that. And always try to look out for any updates of the edition. So if there's any changes being made to any edition, any more suggestions or any more requirements came forward, we worked on it. We would put the latest updated version online where you find the original one. So if you are printing or whatever, you can use that. And if you were to print it or reproduce it, all we'd request is that, if you could send a courtesy copy just for our own records. And finally, I'd just like to remind you, the way Dr. Jamila mentioned, there will be a link in the chat for evaluation and feedback. Please do take your time out, and it'll only take no more than a minute, and it'll be really vital and very useful for us. So thank you ever so much. Now I'll hand it over to my colleague and friend, Dr. Hina.
Thank you so much, Imam Asad, and thank you for putting in context the guidance and why we've developed it. And thank you to all of you for joining as well today and taking time out of your busy day. So I am just a bit of background about me and my interest in this piece of work. So I'm a GP in Northwest London, and I've had an extended role in frailty and end-of-life care for the past 6 years around inner Northwest London. In that role, I've supported patients and their families to die at home. And through that work, I've seen various challenges in the community, in the communities that I have looked after. So it's a very diverse community, but with a significant Muslim population. And so Imam Asad and I, got talking about some of the common challenges that we see on the front line in the Muslim community. And that was really the impetus for us to come together and develop this guidance. Just to say, and I'm sure as Imam Asad has already mentioned, this is intended to be a practical toolkit, not an academic discourse on ethics or bioethics or going into the nitty-gritty details of why certain decisions are taken and some are not. We have received a few emails about that, so I just wanted to take this opportunity just to clarify that this is all based on kind of giving practical tips based on our own insights and experiences of working on the front line with patients and communities who come from a Muslim background. There are some key areas that I think would be worth highlighting, but I really would like to use this opportunity to take any questions from the audience that you might have. So firstly, we do know, as Dr. Jamila alluded to, that there are specific issues within the Muslim community around palliative care guidance and palliative care support and planning, and partly due to misunderstanding around what palliative care really involves and why it's important. From my professional experience, what I have seen is that what that does is that it means that patients don't get the care that they don't get cared for in the way that they would have wanted had they received full information about what end-of-life care and palliative care support looks like. So in the guidance, we cover issues around what some of the treatment options are and why we give certain treatments, some of the side effects that treatments might have, and the need to kind of balance harms and benefits. And the key theme that comes out throughout the guidance is the importance of regular communication with patients and in particular their family, because we know that in the Muslim community, the family takes a very active role in supporting patients who are palliative and at the end of life. We've also included in here some information about who should think about be referred for palliative care or think about contacting their own GP to have this palliative care discussion. So, for example, patients who have a long-term or life-limiting illness, or anyone over the age of 80, and especially those who are at risk of losing mental capacity, it's really important to have those decisions. And the reason is to make sure that their care that they receive is in accordance with their needs and preferences and takes their views into consideration. And it's so, we would encourage them, the families or patients, and there might be people here who do have loved ones and relatives who may be eligible for palliative care conversations, to contact their GP and to do that. And linked to that is preparing for death and end of life, and the importance of advanced care planning, or which is also known as respect. Again, this is something that isn't very well understood in the Muslim community, and what we see is that families understandably want to do everything possible for their loved ones, and sometimes that means that they may end up, for example, being admitted into hospital repeatedly, where that may not be in their best interests medically, but also if that patient is not able to communicate their needs and wishes, that that isn't taken into consideration, and they end up being cared for in a way that they would not have wanted. And advanced care planning is really to avoid that from happening. So it's done at a time when a patient is able to communicate their needs and preferences, and then that's documented. So Coordinate My Care, or in London, the Urgent Care Plan, which is a service that helps patients and professionals to record those important conversations. And importantly, a patient can start an online record themselves. So, you could, so a relative could also sit down with a patient and start that process. And then when they get to a certain point, they need to speak to a healthcare professional. The other issue is around do not resuscitate, or do not attempt cardiopulmonary resuscitation, DNA CPR. There are some misconceptions again in the around that. So linked to wanting to do everything possible for a patient, relatives might say, well, we want CPR, we absolutely, of course we want it, there's no question about it. But actually, when what I have found is when I take the time out to sit down and speak to them about what CPR actually involves, what the impact would be on quality of life should CPR be successful. So, for example, if a patient is previously, able to kind of mobilize and communicate their needs, but after CPR they're not able to do that, so they may become functionally dependent and not be able to communicate, then is that something that they would really want to do? And when when sometimes you discuss the reality of that, then it can support patients to take a more informed decision. So those are some of the key issues that come up. We've also covered some challenges in particular around communication that professionals may encounter and what can be done around that. So in particular, things like cultural practices and the importance of not making assumptions, but asking patients and their next of kin and family about what they would want with clarity, language barriers, and the importance of always trying to have independent translators and not just depending on relatives, especially for sensitive topics around end-of-life care. And now we do have quite good access to translation services, through various phone service providers. The importance of having decision makers, so trying to identify and appointing a named point of contact, which is normally the next of kin for the patient. So sometimes we find that as a healthcare professional, I'm having conversations with several people in that patient's family, but actually it's much more helpful to have one identified person who we can communicate with, and they can then communicate out as well to the rest of their family. And there may be some tension that may arise around religious rulings, as Imam Asad alluded to. We're not a homogenous community, and there, people's interpretation of religion, especially around end of life, may be quite specific and unique to them. And so, there is support available in the community. So that might be an imam or a chaplain who can be consulted should any of these queries arise. We also cover in the guidance some contemporary issues, around organ donation, for example, but these are just to contextualize some of the challenges that we see, as I've mentioned before. it's not an in-depth analysis of the legal or the ethical positions, and also physician-assisted dying and euthanasia. We cover that as well because it is quite topical. And then finally, a section on funeral and burials as well, for relatives and families to think about in terms of planning, which can be, you know, very crucial. And related to that is the issue of death certification, which comes up time and time again. And the key message I would give to anyone who finds himself in a position where they've got a relative who is palliative care or at the end of life, and in the Muslim community, as you may be aware of, early burial is highly recommended. So it's really important for a patient to have been seen by their GP within the last 28 days, because that can avoid some, you know, unnecessary delay with death certification. So if, for example, you have a friend or relative who has come out of hospital who you know, could die within the next 28 days, it's really important for you to make contact with your GP, with that patient's GP, to let them know. Normally we would get, you know, a discharge notification, but we know that there are backlogs in, you know, in paperwork with letters coming through. So you know, my advice will be to make sure that you do make contact with your GP if you feel that that might apply to you. So those are some of the key areas that I wanted to highlight. I'm sure there are many others, and you know, if you have questions, I'm happy to take them as well. Thank you so much for joining again, for your attention.
Thank you very much, Hina and Imam Mohammed Asad. I think some, you know, very, very practical points there. And to me, you know, what stands out is the great need for healthcare professionals to work in partnership with imams and chaplains and mosque leadership on issues around end of life and palliative care in the Muslim community, particularly where there's misunderstandings, as we've touched on, with regards to some aspects of palliative care, to open up that discussion, to think about for healthcare professionals how they, you know, we know that healthcare professionals find the challenging to approach the discussion around advanced planning and end of life discussions. So thinking together as communities how we can facilitate that discussion, bearing in mind some of the understandings and beliefs that we've talked about. Just, you know, thinking about what's been said, I think there's a real need also for a community Muslim chaplaincy or faith-based service. We've got that support in the secondary care, but actually if we want to facilitate these end-of-life discussions, we need community palliative care champions, community chaplains in the, you know, so people who can facilitate those discussions in primary care, in community palliative care, and how as service providers we can have some of those discussions. So there's some of the reflections coming out of what Dr. Hina and Dr. Mohammed Asad have said for me. So we'll open up the floor for questions now. And also, you know, if you want to put any of the questions in the chat, I think some of the things that I can see already have come in the chat are about when loved ones, you know, when about food and drink, and sort of practical guidance about that when they're unable to eat and drink, you know, I think it's to do with the family's desire to care for them and look after them the best way. And I think practical suggestions how you might approach as a healthcare provider, healthcare professional, some of the discussion. And I think it'd be very valuable also, you know, tips for healthcare professionals and how to approach that discussion around advanced care, opening up the end of life care discussion. So please, yeah, come forward to, you can state your questions over the microphone, or you can put them in the chat, and we really welcome that discussion.
Thanks, Shamila. I might start by answering a couple of the questions. Some of them are linked. So there's some questions around pain relief and how this may impact. So what your suggestion about using morphine for pain relief in the Muslim community, it would be helpful to understand exactly what your question is around that. I know somebody else has put in something around sedative medication and the side effect of quickening death and what the advice is regards to this. So what happens at, when a patient is approaching the kind of very final stages of life, and they have symptoms which may, can range from severe pain through to a lot of agitation. And in those instances, we may give medication with the intention to reduce suffering and to alleviate those symptoms. So that is a primary intention of that treatment. As with any treatment, these medications can also have side effects. And a side effect, for example, of morphine may be to make somebody more drowsy and unresponsive or less responsive, and similarly with medication to reduce agitation as well. So again, like all decisions and discussions, this will be one that is had between the family, the next of kin, and the healthcare professionals that are involved in that patient's care. So that could include the GP, district nurses or community nurses, palliative care nurses, community palliative care consultant as well. So these are discussions that would be had. There is no blanket advice and guidance. These are all individual discussions that take into consideration patients' needs, preferences, the social situation as well around the patient. So that's the key take-home message. These are, the guidance or advice in this document is not meant to be kind of imported wholesale. It's important to have those individual discussions. There's also a question around of course, there's so many questions, but the question around brainstem death and neurological criteria and withdrawing treatment. Again, I just want to say that this guidance is aimed for supporting patients to die well in the community. In intensive care, in hospital settings, there are a lot of other professionals that are involved in making those very complex decisions. So ITU anaesthetists, who will be involved in very intense discussions around, with relatives or next of kin of that patient around what's in the patient's best interest around withdrawing and withholding support as well. And yes, there's a question as well around, you may be aware that there will be some statutory changes next year around medical examiners and death certification. So we will be aiming to update this when this guidance, when we get, when that comes through. Just to say again that currently what happens in out of hours settings is quite localized. So there are some coroners, for example, or out of hours support where you can register a death and get a death certificate, and in other areas you're not able to, and you do have to wait until the GP opens. So there is regional and local variation in how those services are provided, but that will change sometime next year, and we aim to update the guidance accordingly. If I've missed any questions, and I'm sure I have, please let me know.
Just to come in, there were some questions around death of a child and any specific guidance for children, and in terms of bedding for children when there's post-death visits. There's a question around organ donation allowed in Islam? Yeah. So yeah, no, there's no specific guidance for children. There's probably advice within the guidance about the bedding position, and that would be the same for children.
Yeah, Imam Asad, that was.
Yes.
Thank you.
The main difference between children and adults in Islam is that as soon as a girl or boy reach the age of puberty, then they will be held questionable and answerable in front of God on the day of judgment for everything that they've done. But if it's a child, then a child is regarded as an innocent individual, and we don't pray for the forgiveness of their sins, but we pray that they become a means of entry into paradise for the parents. So there's slightly different prayers that are said for a child and slightly different prayers when it's an adult or teenager. So with a child, it's regarded that the innocent child is going to become a means of entry into paradise for the parents. There isn't any major differences that after they pass away, when you lay the bedding out, etc. But I would always stress that it's a lot to do about educating each other. And you wouldn't expect that the Muslim families know it all either. There'll be many times that they need guidance themselves, and especially many times a person has knowledge, but because they're in a state of shock that they just heard their loved one pass away or whatever, then they would need reminders. And this was the other purpose of this guidance as well, that there'll be those Muslim families that are not so educated. Some will know about things, but they need reminders in these difficult times, so they can refer to this guidance and seek guidance from it and seek support from it. So it's always best to sit down and to talk to the family and the loved ones. And that is why there are the Muslim chaplains. There's males and females throughout the country that you can seek help and guidance from and call them in. And normally when the family are told even about withdrawing treatment, it comes as a shock to many of them. And they themselves don't want to do anything wrong. So they would prefer to talk to an imam or a Muslim chaplain or a female and seek guidance from them and just reassurance that is it the right thing that we are doing or not. So it is really helpful to have these dialogues, and there'll be many families who have cultural practices which might not necessarily have much to do with the religion itself, but they will want to get those, practice on those cultural practices as well. So just seek their wishes and desires, and you would try to fulfill them as best as possible. Yeah, Dr. Jamila, anything else?
In terms of questions coming up, I think that
something about organ donation that
yeah.
Oh yes, organ donation. There will be a group of Muslims who understand that it is right. It's it's good that we should be helping because there's virtues about helping others. So they will think and think that it's fine to be able to give your organs after death. And then there will be a group of Muslims who will think that no, this body is a trust. It doesn't belong to us. It belongs to God. God has given it. And that is why when a person passes away, that is another reason why there's a fast track burial, that we want to give this trust back to God the way we have been given. We are just the caretakers. We don't have any say in it. So they will say that, no, it's not right to give your organs. And then there will be a large group of Muslims who are uneducated about both sides. So you will find all sorts. You'll find Muslims in all three categories. So we're not here to say that you should or you shouldn't, but we're here that to stress that we need to be educated about all aspects and leave the decision for the individuals to make, that whether they want to go ahead with it or not. Yes. Yes, over to you, Dr. Jamila or Dr. Ina.
So we're coming up to our sort of last 5 to 7 minutes. So if there were any further questions, if anyone wanted to directly ask their questions, you're welcome to. Yeah. There's a lot of interesting points that are being shared on the chat. So thank you for those suggestions, sharing of the information.
Assalamualaikum warahmatullahi wabarakatuh. Brother Imam Muhammad Assad, I've got a question. When any patient near to the end of life and putting the end of life medication or sometimes sedating the patient, how we can before the sedation, maybe after the sedation they will wake up or not, but how we can create the awareness to the nurses and doctors. Before the sedation, they need to contact, especially the Muslim patient, they need to contact the imam to do the person's last rite, like talqeen or like tawbah and istighfar. This thing, how we can make awareness? What is your suggestion?
Sorry, that last bit, how can we make?
How can we make aware to the staff who is looking after these people? They need to, or making any policy, they need to contact to a chaplain or imam.
Yes. Yes.
They should do the last rite.
Yeah. Thank you so much for your beautiful question. I know the practice varies from place to place throughout the country. I know there's some awesome practice in some of the hospitals, especially here in West Midlands that we've got. In one of the hospitals, I know there's a beautiful practice. There's a team of Muslim doctors and nurses, many who are well versed with the Quran and many who have memorized the Quran as well. So what happens that as soon as there is a patient identified end of life, then even before a chaplain is contacted, there is an internal call amongst this team, and whoever's free, a doctor or nurse, they will come instantly and then they will start reciting Quran by that patient until the chaplain comes in. We faced many challenges during COVID. So what we introduced was the Quran players, because the chaplain could not be in every single place all the time or could not stay there for long, and because of the PPE and many other challenges that we had. So we introduced the Quran players that until a chaplain comes or once a chaplain's prayed, that they can leave that Quran player that will constantly be playing Quran and doing the talqeen. And I think, you know, this is one of the major challenges Muslims face in hospitals. If it's end of life, then the Muslim belief is that everybody wants to be there praying for that individual, their loved ones. And if it's in critical care and they've got life support machine on, and the biggest barrier that the family faces, that only limited people are allowed, or just immediate family members are allowed on the ward, when contrary to Islamic beliefs and practices, everybody, the whole family wants to be there praying for that individual, because they are seeing this individual off, because they are going to start a new life. So how they leave the world means so much to them. For example, I can give you an example, what might seem like a simple thing. If anybody's finger when they're passing away was sticking out like this, generally Muslims would believe that is a awesome indication that that person was successful, because they are pointing out, they cannot speak or talk, but they are saying there is one God. They are reaffirming their belief. So these small things, it's all about educating each other that, you know, they mean a lot for the Muslims. And many places do have this practice in place that as soon as it's identified that end of life, instantly a Muslim chaplain comes in. And I've seen this, that even those that are not Muslims, I've seen staff members, you know, try to practice or put Quran cubes in place or put things in place that they have learned through guidances or workshops or trainings. So the short answer is about education, educating the staff in whichever settings they are about the needs for the Muslims.
Jazakallah khairan for your nice.
Jazakallah. Thank you so much.
Imam, it's Professor Gatrad. Could I ask you a question, please?
Sure.
Yeah. I wrote a book on palliative care on Muslims, Hindus, and Sikhs quite some time ago. But there's something that I was not very clear on, and this has been raised sometimes, and that is, you know, when a person, Muslim, dies, generally speaking, we don't have them facing their feet towards Mecca. Okay, so apparently there's our belief that our soul comes out from our feet or whatever. Could you sort of enlighten us on that, and the direction of where the bed is put, and guidance perhaps to the audience as to what we should do? And a lot of people in the audience do not know that, and I can tell you from personal experience, that if somebody is praying, you do not pass in front of them. Okay, so could you advise us on that, please?
Thank you so much, Professor Saab, for taking out your time and joining us. And thank you so much for your lovely question as well. In short, there are both practices in Islam, and people will be doing both things. If they have their feet towards Mecca, facing towards, it means that their face is facing towards Qibla. So a patient is flat out on the bed, but there is that practice which is practiced in different parts of the world as well, that yes, people will believe that it's a matter of having your face towards Mecca, and that doesn't leave you with a choice, but your feet are pointing towards Mecca automatically. The other one is that a person will be lying on the side and they will have their face turned slightly towards the right-hand side, which should be towards Mecca as well. So both practices you will find within the Muslim community. And sorry, the other question was?
Yeah, there was a question around
walking in front of the person who is praying.
Yes. That when Muslims are praying, there shouldn't be, when they're in the prayer room or wherever they are, there shouldn't be anybody walking in front of them. That is an understanding within the Muslims and a Muslim community. But an alternative would be that somebody might put their bag or something in front of them. And if somebody walks in front of that does not directly disturb their prayer. But at the same time, there will be places around the world, especially even in Mecca, where people are constantly, because of the rush, the crowds, people will constantly walk in front of others, but that is regarded as not good practice, that there shouldn't be anybody walking directly, especially the place that you're going to bow down and you're going to go down. So people should not be walking directly in front of you. And the people that are praying, if they think that people are going to be walking, if they put something like a bag in front of them, then that should be fine. But again, with these kind of things, there's slightly different understandings within the Muslim community. And we as leaders in the community, we would respect whatever different opinions people would have and try to accommodate everybody as best as possible wherever it is possible. Thank you so much. Over to you, Dr. Jamila.
Imam Asad, can I just ask you to maybe answer one question that's come up a couple of times very quickly? We just have a couple of minutes, if that's all right. And it's this issue of giving medication to patients who are, the pain relief, or in this case, midazolam for agitation, and the family is refusing because they want the patient to pray, and the patient's clearly looking distressed or in discomfort. What would you say there?
First thing that comes into mind is that I would, wherever possible, to get a Muslim chaplain involved in the scenario. Because if a health professional is saying something to the family and the family are hesitating, it's like many times we as a chaplain, we get a call that, oh, please can you come in and talk to the family because we want to withdraw the treatment. So they are not agreeing with us. So majority of the time, what happens is that the family want to do the right thing, but because of not being well versed in Islamic principles and the terms and what they're getting into, they just want to be reassured by somebody else, and especially a Muslim leader, whether it's a female or male, whatever their choice is, that they just want to hear from somebody else that just because they do not want to do anything wrong in the eyes of Allah, in front of Allah, they don't want to do anything wrong. So, and when a chaplain or comes in, what they would do, they would not say, do this or do that, but they would give them, again, informed choices that this is a situation in Islam. we are allowed this, and you can do this and these kind of things as well. And majority of the time that it works fine and well, that they have, went out, asked for help, and they've got some guidance, and, they can reassure themselves as well that, they didn't do the wrong thing for their loved ones. And it's about trying to make them understand that as a Muslim, what is our belief? That, if there's less benefit and more negativity in the situation, then, what can we do? And at the same time, we don't want to make anybody suffer unnecessarily, and we want them, to begin their journey for the next life, the life in the hereafter, as smooth as possible, because it is a transition of the souls. That we as Muslims believe that there was a time when all the souls were together, then we were in the mother's womb, then we came into this world, and then we just as a traveler moving on into the life hereafter. So just educating them about this, and it does really help, and it does make a difference.
I have another small question regarding these issues, which is, especially when they're trying to do the treatment, but then is stopping the food. Like you can give fluid through mouth is hard, but if you give a saline or anything like that, without food, people cannot live when they are very weak. So in this scenario, it is allowed to take stop the food or giving any kind of fluid in the body for sustaining. If not, then this person automatically will die. And is it allowed in Islamic principles?
Okay. Again, I would say and suggest that, there will be different beliefs within the Muslims and Islamic principles. So it really basically boils down to the family and the scenario and the situation to have that dialogue. And many of the times, the family might suggest that, no, we don't want to talk to the hospital chaplain, but we want to talk to our own imam who they have great faith in, or the local imam in the mosque or whatever. So it is always encouraging to get them to get some guidance, whoever they trust, whoever they believe in, and it will make a difference whether it's calling them in or over the phone or whatever, because once they know that the situation, there's more harm in keeping this individual in the situation they are in and making them suffer, when Islam tells us that we should not make anybody suffer unnecessarily, then once they've got the medical guidance, once they've got the Islamic guidance from a person that they trust, many times, they don't have anybody and they are fine with the hospital chaplain or the hospice chaplain to come in and give them guidance. They are fine with that. But sometimes because of mistrust or whatever, they want to seek guidance from their own local imam or whatever. But having that imam, whoever's coming from outside, updated with the situation, and for him or her to give that family that information is really helpful, then rather than just health workers just trying to drill something in and repeatedly, trying to get that family to agree. I think it is really beneficial to let them seek guidance from somebody who they trust, whether it's inside or from outside.
Thank you. So just rounding up the discussion, there are a few more questions. There's one around how the community responds to someone who's committed suicide, which is a very big topic. I don't know, Imam, if you want to tackle that now or respond at a later time, given that we now have sort of 5 minutes before our end time. What would you like to do?
So basically the principles, the teachings of Islam is that to preserve life as best as possible. Different communities will take that very differently, and depending on why that the situation, the scenario behind it, why that individual committed suicide or whatever. So there's various reactions that you'd find, but the basic principle about in Islam is that we should try to preserve life in whatever situation as best as possible until there is no way that, you know, we can save a person's life, and then end of life procedure will kick in.
There's also a question around, are there Muslim chaplains available at all hospitals? As far as I'm aware, they are available at most hospitals. The Imam can tell us more. Unfortunately, yes, as we mentioned, they're currently not available in the community or primary care. And we can see there's very much a need for that, given that you know, most Muslim families choose to care for their loved ones at the end of life in the home.
Yeah, exactly. So majority of the major hospitals up and down the country, they have Muslim chaplains. Some are paid, some are volunteers, some are bank chaplains, but there would be access to majority of the major hospitals. If there isn't, and you know, if there's a need for it, then I would say that, you know, that should be raised, and Muslim chaplains should come forward, and you know, hospitals should have chaplains, but where it's an end-of-life case and majority of the families would rather prefer to go home and be with their loved ones rather than be in wards where patients, where family members are restricted and cannot be with them. So there are, if there isn't a Muslim chaplain, there's always imams and males and females in the community who would and can come out and would help. So the next bet would be that, you know, if you can't find anybody in the hospital, then contact the local mosque and see that if they can offer any support and assistance. And yes, I'd just like to remind everybody, anybody who needs to go, or we have come to the end of our session, that again, I'd like to thank everybody who has attended, taken out their valuable time. Please make sure that, you know, you do fill that evaluation form on the link. And I'd just request Dr. Jamila if she can post the link back again. And please do, and thank you ever so much. Over to you, Dr. Jamila.
Yeah, thank you, Imam and Hina, very much for both the production of this brilliant guidance, which is much needed, and lots of practical tips to aid both families and healthcare professionals, and for the brilliant session today. Thank you to all the participants, so many brilliant questions and so much interest and a real desire to provide culturally sensitive and faith-sensitive tailored care and improve the current care that we provide. We'll try to address and answer any questions that have come up in the chat that we haven't addressed. Everyone will again receive the guidance. There will be a recording of this, which we will email out to everyone. Please share widely with colleagues. I've also put a link within the chat to the Muslim Council of Britain and Cambridge University end-of-life care report that I mentioned. I think others have shared other useful links, and you have also shared emails, so we have a good contact network here to take this work forward. This is the first edition of this guidance, so your suggestions are very much welcome. It will be updated on a regular basis. I have again posted the link in the chat, and I'll do it one more time, so please do complete that. And finally, thank you very much to all of you for joining and taking out this time during your lunch break. And thank you for our speakers and authors of the guidance.
Assalamu alaikum. Before you go, just a quick to highlight that there is a website for National Burial Council. And as a vice chairman of the National Burial Council, my name is Ghulam Chaladia. I work with Brother Muhammad Umar. Some of you might already know him. There is a website for nbc.org.uk. You can log into there, and we also
thank you. Can I just, sorry, just because we're running out of time, can I just ask you to please put that in the chat? Is that okay?
Okay.
Just need to wrap up, but thank you so much. I know that the National Burial Council does some really great work, so yeah, if you could just put the details in the chat, that would be really helpful. Thank you.
Thank you, everyone.
Thank you so much to everyone. Thank you for participating.
Thank you so much. Assalamu alaikum. I think
Yeah.
I think
Just had a quick question. Can you hear me?
yeah, I can hear you. I think Imam Asad, I don't know whether I removed him or
Did you remove people? You know,
I just
some
removed
people
them.
have direct messaged me. I don't. So how will that come up? For example, this N Ahmed, he's a chaplain at NCA. I'm not sure what that is, but so he wants. So I think, what did he ask for? He just wants future program links. But I think it's worth making a note, you know, to go through who people, you know, who everyone was that attended and their contact.
I've saved the chat. I don't know if the direct messages get saved as well.
Yeah.
To be honest, but I have got to dash. I've got a course that actually started at 1 and I said I'm going to join at 2. I know. So I've just got to dash, but I think maybe we can have some time for a bit of a debrief at some point.
Yeah.
But I will be in contact. Thank you so much. That was really great chairing. Thank you. Did it go? Do you think just
yeah, you know, I think the whole thing went well. I mean, a lot of interest, and it's interesting, you know, probably it's worth knowing beforehand what the kind of main things are going to come up, because very much around you know, which you kind of can preempt from. That was the findings of the you know, this study that was done in 2019. It's very much around the issue of oversedation, and that is a problem, and that's really coming through. So maybe within the guidance, having a particular maybe you know, focus on that, and then we can kind of so maybe for a learning thing is focus on kind of the key areas of focus that we know are there, focusing on those. Or maybe but yeah, we can discuss. But yeah, no, well done. I think overall.
No, well done. Thank you so much for handling those questions and all of that. You know, people coming in as well live. Jazakallah khair for sharing, and yeah, we've received a really good response, and I got so many emails I was going through saying we can't log in, we're at capacity, we can't log in. Like I was like, I'm really sorry, but inshallah we can discuss all of that at debrief. And the learning that came through, I think it's really important to capture that, so that we know what to do better next time, inshallah. But yeah, once again, thank you so much. Jazakallah khair, and inshallah catch up soon. Assalamu alaikum.